Here's Dr. Kevin showing you how to set up the ventilator.
Alright, so the first thing you're going to do is anytime you're putting a patient on the ventilator, turn off your pop-off. So close your pop-off valve. Now remember that this is closed if you go back to regular patient anesthesia without the ventilator, because you will need to reopen it so you don't harm your patient. The next thing you're going to do is hook up your ventilator system to oxygen. And so oxygen is always the green hose. In the back of your anesthesia machine, there is a Y piece with the incoming oxygen to the anesthesia machine and an extra valve here. So you're going to attach this hose here, and you will hear some air leakage until it's tight. And that air leakage should stop once it's fully tight. And you're just going finger tight. You don't need to crank down on it. So
You're taking the bag off.
Oh, okay. So with your system, for this time being, all our patients on the ventilator will be using the F circuit. So our little Bain circuits aren't going to work with the ventilator, but that's okay. The ventilator is going to overcome the challenges of your small patient and a rebreathing circuit. So we're not concerned about having a rebreather versus a non-rebreather on our small patients. Next step, your hoses will be hooked up normally, and they'll just stay that way. We're going to remove the rebreathing bag and set that aside. We're not going to use it. And then we're going to hook the ventilator machine to where the rebreathing bag was. And so this is your clear corrugated tube, and it has attached to it a plastic piece with a clear plastic tube. This is a pressure gauge. This is what's going to help us ventilate the patient appropriately. So the clear corrugated tube goes into the white pressure regulator piece, and that's going to attach to where your rebreather bag was attached. So the other hoses back here, you've got your breathing system we hooked up to where the rebreather bag came. We've got the driving gas, it says. We don't touch this. It stays there always, so we don't want to remove that. And then we have exhaust. And exhaust is where your exhaust goes. So we take it off of the exhaust from our anesthesia machine, and we attach it to the exhaust from the ventilator machine. So our next step, and we're going to turn this around so that we can see it.
So where all the hoses attach is the back of the ventilator, and where all these buttons and knobs are is the front of the ventilator.
Alright, so at this point, you still don't have a patient hooked up to this. It's not operational. You're going to turn the ventilator on, and you have an on switch.
Can I plug it in?
Yeah, I can't though. I can't reach.
Oh, let me plug that in. Okay, now that the ventilator's plugged in.
So we're going to turn it on, and before you turn it on, you want to make sure that your flow meter, and it says volume in mils under here, that this is all the way down. And so all the way down is clockwise. Okay, so it's gone maximum down. You also want to set your maximum working pressure. This is the maximum pressure that the patient will experience before you hear an alarm. And we want to generally set it about 20 or a little less, never above 20. And then we're going to hear some alarms when we turn this on, because the minimum pressure on this machine will be like less than 5. we have no flow, so there's going to be no pressure buildup. So there will be an alarm. Okay, so this is telling us we don't have enough oxygen going through the system. So we're going to turn our oxygen on our anesthesia machine. Right now we'll do about 1. Adjust that for your size of patient. And then we're going to do 2 things. We're going to increase our respiratory rate, and the rate should be somewhere around 12 to 15. And so that'll drive how fast these bellows are going. And now we're gonna get our pressure adjusted so that we're getting a normal pressure and we're not getting the low pressure alarm. The way we do that is by adjusting the flow meter and at the same time watching the pressure gauge on our anesthesia machine. So currently it's about 2. We're gonna wanna see this number increase to about 12. And so we keep turning up the volume flow meter, and once we hit above about 5, the alarm shuts off. But we do want to make sure that we get above 10. So the alarm is off now, and we get up to about 7 or 8. So we want to go up a little higher. And we only see the maximum pressure when it's forcing an inspiration. Okay, so now we've managed to get our number here on the pressure machine up to about 12, and that will serve for our patient inspirations under pressure. So at this point you have the number of breaths per minute set. So this is our breathing rate. We have our flow set. We have our max alarm set. And we have oxygen on. And we're making sure that our pressure gauge does not go above 20 on this especially. And we want to keep it closer to 10 to 15. And we have to make sure that our pop-off is off, or else this whole system will not retain any pressure. So when we hit a pressure above 20, there will be an alarm sounding, but we need to realize...
I'm going to demonstrate that.
Alright, so now here on this pressure gauge we're going over 20, and so there's an alarm sounding that tells you that pressure is going too high. Now remember that this does not stop that pressure from occurring. So if that alarm is occurring, your patient is getting that pressure into their lungs, which can be dangerous. So we want to make sure to correct that immediately. What else?
I think that's good for setup.
Okay.